So the question is, how do we manage and how do we address patients who've had multiple modalities? In the case of the patient asking the question, combination of both radiation and then subsequently cryotherapy, which is freezing of the prostate. Those are two particularly damaging technologies designed to kill the prostate essentially, but in the process it kills the prostate and everything around it. And so it is not uncommon for patients to have a variety of urinary complaints, especially incontinence after that double whammy. One of the important things to look for in this kind of a situation is the bladder hyperactive as a result of the radiation? We sometimes see that radiation, because you can't only and exclusively radiate the prostate, the bladder gets radiated at the same time to a degree. And when that happens, the bladder loses some of its elasticity, some of its ability to stretch. So that has to be looked into to make sure that the bladder is actually able to stretch properly. And that stretchability is compromised. You tend to have too much pressure in the bladder and it will force leakage as a result of that. So that's correctable to some degree with medication. Similarly, the extreme damage that happens when you combine both radiation and cryotherapy to the channel of the urinary tract, where the urinary tract goes through the prostate. If you think of the prostate as a donut, the hole in the middle of the donut is the urethra that you're urinating through, and the donut itself is the prostate. Well, in this case, the prostate has been melted and frozen and radiated, and it's damaged. Well, it's impossible for the hole in the middle not to also be damaged. And what we sometimes see is that channel, instead of being open, you're leaking because it's open, it actually can be very scarred down. And you may be having what's called overflow incontinence, which we talked about earlier, where the bladder actually can't empty properly because it's so scarred down. And it's full and trickling out as a result of that. So there are a variety of issues that come into play with the combination therapies that you were talking about earlier. And so that's a situation where every individual has to be individually worked up with the appropriate tests, looking into the bladder, doing urodynamic testing to monitor the pressures, ultrasound sometimes, and addressing each of the components to try and optimize the anatomy so that you can both urinate properly and hold it properly.